Good evening, everyone, and thank you all for being here tonight. We are totally grateful for your time and being a part of our oncology production tonight. My name is Linda McKee, and I'm the Associate Vice President for the Oncology Division. And this is Dr. Beryl Mean.
Hello, everybody, and thank you so much for your help, your support, and spending time with us virtually. Well, for me, patient-centered care means treating a patient exactly like I want my family treated. Private donations are an integral part of that. Nearly every week I have a patient who needs some kind of resource, be it transportation, gas, medications they can't afford, and they're already dealing with an incredible amount of stress with cancer. So I can't speak anything but great things and how important these donations are.
It's extremely important, to all of us. I think all of us at Riverside really provide the Riverside Care difference, what we talk about our mission, caring for others as we care for those we love. I feel like in the cancer program particularly, each and every one of us, everybody that I've interacted with has a personal passion for what they do in their role. And they may have had cancer in their lifetimes, or they have a family member who's had cancer. And so we all come into the role with a particular passion for what we do. And I think that does make an extraordinary difference for how we provide patient-centered care.
I'm Dwayne North, and I'm the new general surgeon here at Riverside, Walter Reed. I actually moved from Cleveland to Virginia after I was done with training. I actually moved from Virginia though, so Virginia's like a second home to me. I was actually born in the Caribbean, Guyana, and then moved here when I was around 18. So Virginia is home for us now. As far as specifically, cancer surgery, a part of the general surgery training for us specifically in Cleveland was breast cancer. Obviously, we have lots of experience in colon cancer as well. And so that's why I played a role here of doing breast cancer surgery, and then also colon cancer, any GI cancer, actually. And then I also play a role in placing ports for patients who have already been diagnosed and need chemotherapy. So a lot of times the patients will see me for the first time when they're needing their ports placed.
We at Peninsula Cancer Institute are extremely excited about the expansion to our office that is set to start in January, and that could not be possible without the donations and support of Riverside Foundation. We are very lucky that we are going to have more room for our new provider, Dr. Mong, who is an excellent addition to our already excellent team. Right now, in the past, we've just had Dr. Cleel, and she has been really driving that cancer center forward and taking care of the community. And it is really nice with the volume growing in Gloucester that we have Dr. Mong on our side. So we are going to have plenty of providers with that space to be able to take care of all of our loved ones here in Gloucester.
Hi everyone, my name is Coco Mao, and I'm a new oncologist here at PCI Gloucester. And when I interviewed here, I fell in love with the people and also my team. Oncology care can be intense, and there's a lot of moving parts, a lot of visits, a lot of treatment visits. So it can take a toll on the patient and especially the family also. So by bringing care closer to home, our hope is that they can spend more time with the family.
I personally feel that my primary goal in terms of my patient interaction is to make sure they are very well educated about what to expect in their disease path or journey, and also what all the options are. My goal is for them to be part of that process, so I spend a lot of time educating patients about what their disease is like, and how it would potentially respond to treatment, what the treatment options are. So we really go through the spectrum of standard care as well as all the new advances, which again goes with my background of having a passion for making sure that patients are getting the latest and greatest in terms of treatment options, and I want them to participate in that journey. So education is a very big part of it. It's really multifold. I find my job to be more than just a physician.
Here at Walter Reed and in Gloucester County, we're very much like family, and taking care of our patients and their family members is like taking care of our own family. And I've had patients that have been taken care of at the cancer center, and once they've passed away, months and even a year later, I've had family members reach back out to us in an effort that they wanted to give back monetary ways in which that they can help others going through treatment as well, because that they were so touched by the care that they received at our cancer center.
Thank you so much for your generosity and support. Happy holidays!
Hi, we are part of the cancer care team in radiation oncology here at Gloucester, and we just feel so privileged to be here, and we're so proud of our team and just proud of taking care of our community.
About 13 years ago, I had a very dear friend diagnosed with breast cancer, and we had the opportunity to have her come through our center and give her wonderful treatments. She inspired us in a lot of ways. She was a really fun gal, and her name is Linda Kennedy. And so anyway, but prior to that, Linda and I used to get together at Christmas time and make biscotti. And so each and every year I continue that tradition, and I bring it to my family at work, and so they are able to share her recipe and have the wonderful, wonderful outlook to be able to enjoy things that she put in my life, and so I share them with my family that I work with.
Merry Christmas. Thank y'all for all you do to help us.
We appreciate your support in any way.